The children's block of the Korle Bu Teaching Hospital has been closed down indefinitely following the outbreak of a bacterial strain resistant to antibiotics. 5 children are currently undergoing treatment at the emergency unit after being infected with the bacterial strain known as methicillin-resistant Staphylococcus aureus (MRSA). The decision to shut down the block is to prevent further spread of the bacteria and also to disinfect the block. Here's a report by Sarah Ofori.
Usual buzz of the children's block was amiss, but for these children who played. A few nurses strutted back and forth, monitoring patients at the emergency unit. No new admissions, though, were being considered, and this notice explained it all.
The full name is methicillin-resistant Staphylococcus aureus, or MRSA. It's a bacteria that actually can affect both adults and children, so everyone. It can actually be found in the community or in hospitals, and it can be carried by healthy people as well. So you could have the bacteria in your nose, in your nostrils, and not have any symptoms of disease. We worry about it when you have an outbreak in hospitals because you have very young children, you have babies whose immune systems are not very strong, you have children who have conditions which make them immunocompromised. That just means that they're at a higher risk of picking up infections.
Methicillin-resistant Staphylococcus aureus is detected through blood tests, but there are other ways to detect it.
For healthy carriers, you can actually do a swab of the nostrils. And that's what's being done to all staff and patients. So we're having everyone swabbed. You can also do swabs of the rectum, which is the lower end of the digestive canal. You can also look at other, for people who have shown signs of infection, you can look at other body fluids like the cerebrospinal fluid, so do what we call a lumbar puncture.
The bacteria is prone to crowded areas such as hospitals, prisons, churches, schools, especially when carriers come in close contact with vulnerable persons. However, there is no cause for panic.
People shouldn't panic. What I would advise is that people should just ensure usual hygiene. Make sure you wash your hands appropriately before you eat, after you visit the washroom. In fact, hand washing probably is the most important thing that would prevent transmission.
For now, there are no vaccines to prevent the bacteria, yet it can be treated over time.
The treatment for it is another antibiotic called vancomycin, and that's what we're using. Well, it's given intravenously, and so obviously it can only be given in a hospital setting. It's not something you can take at home. For those who had it in the blood, we'll treat them for at least 10 to 14 days, but we will do repeat cultures to make sure that we've cleared the bacteria.
Authorities are screening both patients infected and staff to determine the source of the bacteria. The block will be reopened as soon as it has been rid of the bacteria. People who require pediatric emergency services should be referred to other hospitals. Sarah Ofori, GTV News, Korle Bu Teaching Hospital, Accra.